Hey, good afternoon. This is Dr. Carrie Mendoza. I'm the director of Genspect USA. We've just got some folks filing in. We'll just get started in a minute. Hope everyone's having a great afternoon. We are very excited for this discussion with the American College of Pediatricians. So just to start off, we are really impressed with their amazing achievement to raise, this issue about this important declaration. Well done to them. At Genspect USA, we believe that it's especially important at this critical time that everybody understands the importance of reaching across the aisle to better highlight, this terrible, devastating medical scandal. While we may not all share the same views, it's important, again, to come together in terms of what's best for children and vulnerable patients. And that is the whole point of practicing as a physician and our advocacy. A whole range of diverse groups are now putting their heads above the parapet, which is fantastic, to state strongly that these medical interventions are profoundly damaging. Everything feels really polarized these days, especially on social media, and we think it's essential that we push back against living in an echo chamber, especially online, and welcome a diverse group of people coming together to stop the harm in children and definitely highlight physicians who are showing moral courage. With that, I'm excited to introduce Jill Simons, who's a pediatrician and the executive director of the American College of Pediatricians, as well as Jane Anderson, who's a retired pediatrician and the vice president of American College of Pediatricians. They are going to talk about the declaration, how it came about, and their organization, and how we can all move forward strongly. So with that, I'll pass it over to you, Jill.
Thank you, Carrie. Thanks for having us. Gosh, this declaration, I said this and I've said it many times. It was authored by the American College of Pediatricians, but really we just put to paper what groups like Genspect and many, many other organizations have been, sounding the alarm for years about the harms happening to children. So we just gathered it all together and our resources, we at the American College of Pediatricians, we are very founded in research, and so all the positions we put out there are backed by research and the science, and so we knew that was on our side, but we were getting dismissed and brushed aside. And so in talking with colleagues from all different organizations, there was kind of this sense of, gosh, we should just come together, our voices somehow. And, I think maybe smaller things had been attempted, but really the last couple months with, the release of the WPATH files leak, which you guys did such a great job shedding light on. And then the final report from the CAS review. I mean, I was thinking, gosh, okay, now finally medical organizations in the US are going to change course. But so disappointing they didn't. I mean, some doubled down. And so that was when we really sprung into action. And I was fortunate through our work about a year ago with the launch of our Biological Integrity Initiative. We put a website out and we started to generate a coalition of like-minded physicians and organizations that were concerned about this. And so I just started emailing, calling. I reached out to you, and you were so enthusiastic to work on this with us, and we're so grateful because it took leaders like us to put our names out there, to come together and say, this is something we agree on, and we have to stand up and say enough. So thank you for that, for joining us.
Oh, well, thank you again for doing it. I think coalition building is really, important. And I think organizations that are trying to form and grow, that are having, the diverse opinions, but coming out clearly saying, hey, look, the evidence is showing that this is harmful to kids, or is not the evidence base. I think, for us doing that, we're up against, these long-standing organizations that seem to really be captured, and or they're just not speaking out in terms of how we all practice as doctors, saying, hey, there may be a safety issue here, there's a diversity of opinion, or the research is showing something different than we thought. The longstanding organizations or legacy organizations don't seem to be able to do that. So I think that's, again, why, you coming in and bringing a coalition together is really important. I mean, Jane, what are your, thoughts on how this all came together and what you've, seen over your career with the legacy organizations?
I think one of the important things that this declaration does is it does bring together people, individuals, physicians, healthcare professionals, psychotherapists who are saying, my voice has been suppressed. I've been persecuted or prosecuted for speaking out what is truth. And so this declaration allows us to present truth. And I think it's really important for anyone who hears this webinar, sees what Genspect does or what the American College does. Every individual and every organization who signed this declaration, we all desire the best for children and adolescents. None of us want to see children harmed. I mean, as physicians, our mandate is do no harm, and we really want to be those people who advocate for children. We want them to thrive, live healthy, meaningful lives, but we don't want to see them condemned to a lifetime of medical intervention at a time when their brains just can't really make wise decisions as adolescents. So we hope everybody will realize these organizations coming together saying the same thing, powerful with one voice, take care of our children, do what's best for them.
Yeah. Now, a lot of, our followers know, the different debates, around this. But, Jill and Jane, would you mind maybe just highlighting, the declaration, the statements, and, go into a little more detail about what is there?
Sure. Jill, do you want to start with some of the things?
Yeah, we start out calling on our colleagues in these legacy medical organizations, the AAP, the Endocrine Society, there's a list of them, to immediately stop social affirmation, puberty blockers, cross-sex hormone surgeries. So that's, very clear what we're wanting them to stop. And then we start with where this discussion, needs to start and needs to be based in that, sex is innate, male and female, and you can't change that with surgeries and hormones and things like that. And that children instead have to be cared for the whole person, just like we do any other medical condition. We base all of our other medical treatments on science, long-term outcomes, evidence-based medicine. Why is this being treated differently? And so that's, we start out with the we affirm and lay it out there. And then Jane can talk more about, we go into just the overwhelming evidence, of why the research, why we say this, that these things need to stop. So Jane, it's a long list. I think we have 12 points in there, but we just felt it was important to have this comprehensive list in front of everyone.
Yes. Well, I think one of the important things for people to know is that children and adolescents who are uncomfortable in their biological sex will normally become comfortable. It's what's called desisting. They will desist if they're allowed to progress through normal puberty. I mean, at normal puberty, the brain and every part of the body, but the brain is just overwhelmed with this flood of sex hormones that are sex specific for the individual. And so most of these individuals are going to feel very comfortable at the end of adolescence. And it's very interesting to me when we really dig into the research, the pro-affirming Endocrine Society in its guidelines says that the gender incongruence of a minority of prepubertal children appears to persist in adolescence. They acknowledge 85 to 95% of these children, if allowed to just go through puberty, are going to feel comfortable in their biological sex without all the interventions. And along with that, I just want to emphasize the adolescent brain. It's one of my favorite topics because we sort of Shakespeare talked about how adolescents, drove their parents wild, but we know they're immature brains and we know they're developing, and they're looking now at how adolescents make decisions. And in emotionally charged situations, they're less likely, to make a wise decision that has long-term consequences. They don't understand it. And from the WPATH files, my goodness, we found out they admitted that some of the parents don't understand the biology either. So that to me was another huge point. We could go through the whole declaration, but I just want to emphasize that one of the things that parents are faced with when they have a child who is feeling confused is they're told by these gender affirming clinics, do you want a dead daughter or a live son, or vice versa? And the threats are horrible. They're basically telling parents, it's your responsibility to keep your child alive by assuring them that they were born in the wrong body. You're assuring them of a delusion, basically. And the point is that we have a whole paper on the American College of Pediatricians website on the mental health of children with biological incongruence, or incongruence with their biological sex. And there's no evidence that social affirmation or puberty blockers or cross-sex hormones, let alone surgery, will do anything to improve their mental health. It does not decrease their rates of suicide. And so that's a horrendous onerous task that's being put on parents. And also want to mention, children look to us as professionals, as adults, as parents, teachers, physicians, to tell them the truth. That's how they learn what's a fairy tale and what's reality. And if we're confirming to them that they were born in the wrong body, we're telling them there's something wrong with you. And what a horrible thing, what a horrible message to tell a child. We as adults agree there's something wrong with you, let alone that we're confirming a delusion. So maybe I better pause for a minute because there are other things in the declaration, but I'll take a break.
No, that is excellent. And that's obviously, been one of the key points that, everyone is struggling with, like, talking about the evidence base that's not there, but then it seems to always degenerate into, well, this is going to make them feel better. And then, they won't commit suicide. And as you pointed to, there's more and more, papers around that showing that that is not the case. The papers that do purport to say it's helpful as a suicide prevention obviously are fraught with, methodologic problems. Mostly, their surveys or the follow-up is poor. So I think it's very important to continue talking about that point. But I think just to dive deeper, as both, Jill, you're practicing, and Jane, you certainly had so much experience with, in the doctor's office with, or on the wards with the distressed, parent who has a struggling child. That, as a parent myself is just like the absolute gut-wrenching worst feeling in the whole world. So we understand that terrible feeling of distress on the parents' part as well, and the vulnerability. And how just, or what are, again, pulling in your declaration, which I think is such a great touch point for practicing physicians, but what are just some of those, how would you interact, what's the advice? How would you handle that situation, in the doctor's office?
Yeah,
yeah, go ahead. Sorry.
Right. That's one of the things that most distresses me. It really breaks my heart that people have lost faith and lost trust in doctors and our health system. And, so we're here saying, the American College of Pediatricians and, others like Genspect and the physicians you have, are saying that we are going to provide you with the best medical care that we have evidence for. And like you both said earlier, we're not going to do harm. That's our, our number one priority. And you're right. This is heart-wrenching for parents. I mean, as a parent, I can't imagine. And, you don't have to be a doctor to know there's kids in your kids' school, or, in your community that are going through this, and the struggles. So I think it's just as important, and we know this as pediatricians, to support the whole family and, with the child, and help them go through, natural puberty, help, give them the support they need, with behavioral health, mental health, to really, not cover up the problem, to figure out how to help this child. And so I think that's my biggest message is I want parents to be able to trust doctors again. But, with this declaration that parents can read, with, our website, the Biological Integrity, it's meant for parents to educate themselves. And so we've got resources on there that they can understand with bullet points, even, doctors too, just, break it down simply, so that you don't have to feel like you're at the mercy of your doctor. And you can really make sure that you've got a doctor that you can trust, and you have that good relationship with. So I think that's just as important, that we as doctors do that part of our job to rebuild those relationships and to rebuild that trust that so many have lost in us.
Yeah. The
Yeah.
oh, I'm sorry. Go ahead.
Oh, no, go ahead, Jane. I was going to ask you your thoughts. Yeah.
So I think one of the wonderful things that the Cass review did was Dr. Hilary Cass took years, and she surrounded herself with dozens, if not hundreds of people, researchers, scientists. They reviewed so many systematic reviews and papers. And so she did a lot of the work so we didn't have to, and came out with this report, which is 388 pages long, all referenced. And I think the important things that, 4 really big points that she makes in there is that social transition is, and social affirmation is not benign. It's not just like a neutral event. The children who are socially transitioned are much more likely to go on to a medical pathway. And so we need to be very careful, as we've already mentioned, about socially transitioning kids. Puberty blockers, which is sold to parents as a way of, we can just take a pause, we can just let nature work its course, let's take a pause so that the child can figure out who they are and who they want to be. It's very damaging. Those puberty blockers are used in medicine, to treat medical conditions, and puberty is not a medical condition. And important things happen during puberty. And if we block it, we don't know that time will ever be recouped by the brain. And importantly for these parents to know is that Dr. Cass ended up saying there were no changes in gender dysphoria or body satisfaction with the use of puberty blockers. And there was a lot of concern that it might just continue to put them on a trajectory of, now I need to use cross-sex hormones. And then regarding cross-sex hormones, there's no evidence that they improve the mental health well-being of children and adolescents either. So we have to be so careful before starting children on this kind of a pathway. Since the Cass review, it's amazing. In just the last month, even since we wrote the declaration and had the coalition sign off on it, there have been a couple of new studies that have come out, literally saying, and I have to find the quote for you, because this is just really calling out the American medical societies. An article that came out this month in Acta Pediatrica said this analysis, and they're talking about puberty blockers. This analysis suggests that contrary to assertions of some experts and North American professional medical organizations, the impact of hormonal interventions on depression and suicidality is unknown. So we're not doing we are not benefiting our children. We just have to be so careful.
Right. So important. And on that, issue again with mental health issues and the, increasing problems in the, digital natives, and, lots of books that have come out, Abigail Schreier's and Jonathan Haidt. And it's certainly a complex issue, right? With this new technology of social media. It's almost, people make the analogy, it's like when the printing press came out, and, there's all kinds of chaos, but so many different factors. But, again, we know the evidence is calling towards not medicalizing, but, doing, traditional, psychotherapy first to work out these issues. And we've seen the trend, at least in the United States, that traditional psychotherapy, is being branded as conversion therapy, so just traditional exploring what is going on, what are the root causes, keeping the mindset open, having a therapist that is neutral in terms of exploring these things is being branded as conversion therapy. And obviously that isn't true, and at Genspect that is not something that we don't stand for, what is historically known as conversion therapy, where they're trying to, change people's, sexual orientations or attractions and things like that. And so this sort of bullying, I think, and trying to silence people to come out and talk about this because they'll be branded as, oh, you're, for all these, old retrograde things that are unhealthy, I think has just been very, it's part of what's been quieting people down to be scared to talk. And, just, we obviously at Genspect, so many people work on the importance of traditional exploratory therapy. And so I think it's important, for you all to be able to share your view of that as well in terms of the role. Yeah.
Absolutely. We're on the same page there. This term conversion therapy and all the negative connotations that it means, really has been applied, as a name calling method to try to intimidate and to shut down people who have, a different opinion from the major medical associations. So yeah, to reiterate, the American College of Pediatricians does not support any coercive, physically harmful, any damaging type of mental health psychotherapy, whatsoever. We support the traditional, mental health and behavioral health therapy that's needed. And even now we're seeing therapists being afraid to, they're not even allowed to do that therapy, to explore any underlying issues that children who have discomfort with their biological sex may have, things like ACEs and underlying, neurodevelopmental disorders. And so that's just a tragedy. That's what these children need. And the whole family, again, getting back to children need to have, their family around them through this, or trusted adults, supported. So I think we're on the same page with that. And I think the more we can say that, so to push back against those that try to put that label on us, I think is good to say out loud.
And,
Yeah.
So many of the medical schools and residency programs are trying to teach residents about what's called trauma-informed care, which I think is really, that's a common ground. That's a common term that we can say, hey, we're together on this, because these children do need trauma-informed care. And there are a number of studies that have been done looking at both LGBT children or LGBT children together with transgender children, and looking and saying what's happened to them in the past. And many more of these children have experienced more ACEs than a different population has. And so we want to be sensitive to that. They've experienced trauma, whether it's sexual abuse or physical abuse, or, you know, a parent in jail, whatever it is that's affected their little minds and brains, they need help overcoming that. And most children really are quite resilient. Abigail Schreier's next book is on resilience in children. And, you know, they really are quite resilient, but we need to support them in that and allow the families to recognize that there may have been trauma. We're not blaming you. We're saying we want to come alongside you and help your child and you as a family thrive. And so we do support having a good evaluation of the mental health of everybody in the family, and especially the child, and looking at their previous trauma, their ACEs, whether that child is autistic, because there's a much higher percentage of children who are autistic who are identifying as trans-trauma children. So those things them.
Yeah. I mean, it's just to keep, you know, and open out different factors, situation, and, you know, then narrow things down as appropriate. But, you know, that, you know, you can't, you know, have appropriate, you know, thinking in your head, differential diagnosis, because you're going to be called, you know, names, I think is just so counter to how we, you know, all learn practicing medicine, and still my experience, you know, in emergency medicine. And I think there's just such a disconnect between, I think, activist type conversation and the actual, you know, practice of medicine, which again, you know, psychotherapy to explore what is going on is not, you know, conversion therapy. And being able to point towards, you know, recent studies and, you know, other countries that, you know, have taken a deeper dive into this, or were ahead initially, but then have pulled back for various reasons, and being able to cite their information and all their studies, that is just called healthy, ethical practice of medicine. And again, just back to the, you know, your declaration, I think as a practicing physician, it's very important that, you know, people realize that, you know, when we're documenting in our chart, you know, for us to be able to point and say, hey, you know, this is a gender distressed child, but, you know, I, you know, referred them, you know, to, you know, mental health, you know, clinicians. I didn't, you know, just say, oh, here's, you know, a prescription, because, you know, the evidence is showing that that is not helpful. So as physicians, you need to document properly in your chart why you're doing what. And so again, I just applaud that you guys have put all that information together in a way that I think is very easy to reference. You know, when doctors are documenting, you know, you can't document and say, well, my favorite Twitter thread said XYZ, you know, that's not how medicine is practiced. And I just kind of want to always be bringing the conversation back that physicians and people who are prescribing need, you know, this type of information and this type of, you know, declaration and coalition to point to say, you know, there are a group of practicing, you know, doctors and other folks involved in this who are really standing up. And so I think that is super important. So
yeah, I think,
yeah, go ahead.
No, at the very least, this should open up debate. You know, that's what has been missing from this, is that there's no discussion. It is just said, you know, this is consensus. And so I think, you know, we have shown this is not consensus. There's a large group of physicians and leaders in, you know, the medical community that are disagreeing with the major medical organizations. So if nothing else, you know, having that declaration and being used to stir debate would be great. So.
And as you mentioned, Dr. Mendoza, one of the things that has gone on is that the European countries, which were at the forefront of promoting gender affirming care, and actually the Dutch, who sort of started some of the protocols that have been used, they're pulling back. And so because of the CAS review and some of their own reviews that they've done in their own countries, like Finland, England and Scotland, Sweden, Denmark, Finland, they're pulling back and they're saying, wait a minute, we should not be so quick to push children along a medical pathway, but rather we should look at what the underlying mental health concerns are. And in fact, the National Health Service in England, which was obviously a part of the CAS review, has changed their entire constitution to state we are defining sex as biological sex. And some of the psychologists, both here and in Europe, have said, you know, we're really sorry for the part we've had in this, the part we played. We weren't being, you know, thorough and comprehensive in how we evaluated the children and families. So the European medical societies and their laws are definitely changing. And our hope is that by all the organizations coming together, you know, what you've been doing at Genspect, what the other organizations have been doing, that maybe through the declaration, everybody gets a slightly louder voice and allows what Dr. Simon said, a little bit of debate would be so healthy because there is not consensus. And the science and the research is really behind what we're stating in the declaration.
Yeah. And share some of, I mean, there was one account that there's 53 million views of the declaration, which is just unbelievable. Share, you know, it's along these lines that, oh, you know, the consensus, the science is settled, but clearly, you know, there are a lot of people interested in this information. So I'm just curious to hear, like, if you share, both of you, you know, your thoughts on that traction and some of the comments that you know you've seen there.
Yeah. You know, I know in my heart that the majority of physicians, you know, Americans, people do not agree with these protocols. You know, it's common sense. And so I knew in my heart that was true, but I have been overwhelmed by, I mean, yeah, 52 million views in just, you know, a couple of short days. But the comments, if you read them, are, you know, along the lines of, finally, you know, thank you for stepping out. It's almost as if, you know, again, doctors are leaders, and we were the only ones who could stand toe to toe with these organizations, doctor to doctor, and question them. You know, I think everyone else felt it wasn't in their place, or for whatever reason. But it is our place to question our colleagues. That's what we do in medicine all the time, in the wards, in the clinic. And so, you know, I think us stepping out there, not afraid to ask these questions and to say, you know, this is dangerous, we think you should stop, just open the door for people to feel comfortable stepping out and speaking up. So I'm humbled, and I'm so encouraged by the feedback that we've gotten. And yeah, it's been really hopeful. And I remain optimistic. I always have, even the beginning of this. I am optimistic that physicians will see, you know, the harms, and they will change course like we have. That's how we work. That's how medicine is. We keep reevaluating and changing our practice to the best practice. So I'm hopeful in my fellow physicians.
And, you know, one of the things that we realize is that, you know, this topic has been politicized, and it's gone to the courts, it's gone to the legislators. That's not where a medical issue belongs. A medical issue belongs to be debated, not in the courts and not in Congress and not in the state legislators. It belongs as a debate in the realm of medicine and science, and what does the research show? And that's why we chose, as you know, all the organizations together, to say in this declaration, we're going to the medical organizations, because they're the ones who need to say, let's reevaluate, let's take a step back, or let's just take a pause as we look at the literature that Europe has looked at. So we want this debate back among the doctors, the scientists, the researchers, so that truth will prevail and children will be healthy and helped and not harmed. But keep it, I mean, as much as we've testified in different situations, this belongs as a debate in medicine.
Yeah, so well said. And Jane, just to follow up on that, why do you think that the American Academy of Pediatrics and other the legacy organizations haven't come along, have been slow, and either haven't come out with all, as there's more and more evidence, and also haven't stood up for a diversity of opinion and debate, and haven't stood up for saying, wait, we might still be going along here, but we shouldn't be allowing name calling of fellow physicians or bullying, so that is suppressing scientific conversations related to patient safety. Curious what your thoughts are after your years of practice. Yeah.
Well, having worked at the University of California, San Francisco, where speech can be suppressed, I have to say I have a lot of thoughts, but none of them would be based on science or research, so I have to be careful what I say. I do think that in all of our society in America, we have strayed far away from the concept of freedom of speech. And that instead of allowing a diversity of people to speak on any topic, we've marginalized them or used, things to say, hey, you can't talk, you're not allowed to speak because I disagree with your opinion and it may offend me. This concept of being offended is really not appropriate. Free speech is not free speech if I can't offend somebody with what I say. And I don't mean that I want to offend somebody, but I think you understand that we have to go have the pendulum swing back to a point where we can say we can have an honest and intellectual discussion with each other without using emotionally charged words, without using offensive language, lambasting another person's character. We need to be able to get back to a good sense of let's have a discussion that is free of emotion.
One other point I'll add, the American College of Pediatricians was in their basic founding principles was that any position statement that we make gets voted on by all our membership. So, as these other organizations, these position statements often are made by a select leadership body and put out there. And so I think there's a disconnect then with practicing physicians and a diversity of opinion, or bringing to light new research and new facts. So that's what we hope to foster within the American College of Pediatricians, is to get consensus, get member approval, and that's how we base our decisions.
Yeah, that's a good point, because I do also feel like all the wonderful advocates in the space and talented writers and talented researchers, I think, to varying degrees, they don't understand, I think, what these legacy medical associations have become and how they function and what their revenue model is. And so, again, I mean, I applaud the call to action for them to step up, but I do also think, as you said, there's sort of been some root causes as to like how they got to this, place. I mean, I saw that during, the buildup of the opioid epidemic, where, the American Medical Association, as, certainly thinking of goodwill to create a quality metric around pain control. But then once the evidence was that it hardwired, like measuring pain and attaching reimbursements to that, and then ignoring sort of that, the actual human interactions when it was being misapplied or people getting addicted and overdoses, it's like they, were too far removed to kind of see that and didn't really, pivot. And so I do think sometimes we're in this kind of in between phase that then I saw happen, where there was a lot of, patients being harmed and damaged before the regulatory apparatus kind of paid attention and ultimately, were quietly supportive of some changes. And again, I think hopefully, this declaration, we have to kind of keep pushing at, here's the recent evidence. The detransitioners we know have been out there, very brave young people discussing, what they thought was going on, how they got, involved in this medical intervention that then they understood, was not the right thing. It's like, people that ended up overdosing on opioids saying, well, I just went down this, rabbit hole. So, I mean, I'm hoping that, again, with their voices as well, sharing what has happened to them, that will increase the momentum and the call, to action. So, there's one question in here, kind of back to the kind of the more getting into the schools and social transition. I surely, again, as pediatricians, obviously, you can interact with the different things, going on in schools. I know there's things related to even school-based health clinics now, but I think just this overall all-encompassing teaching and infiltration of gender identity that's in the schools. I mean, what are your thoughts on how to dovetail with schools messages, to schools about how the medicalization is not the answer? Just curious. Jill.
Yeah, we have always emphasized that the family, the parents are the primary caretakers for children. I mean, they need to be involved in the medical decision making for children. So this idea that schools can keep these things secret from parents and all that goes on is just horrifying. We do have some resources on the biologicalintegrity.org website that, for teachers, for parents, even legal advice. I mean, it sort of gets into that area. But our stance is that it should be the parents and the doctor and the child making these decisions, because, quite frankly, there are very few physicians or therapists that are qualified to deal with the seriousness of a child who is, having gender dysphoria or discomfort with their biological sex. I mean, that's a very trained clinician that needs to address that. And to bring that to the, nothing against school therapists and counselors, but, they will agree the majority of them are not equipped to handle that. So we want to bring this back again, getting back to evidence-based care, what's best for children. They need a thorough evaluation, a team supporting them and their family. The declaration, if I don't forget to mention, that it is meant for physicians, leading the charge, being leaders, to sign it, and medical organizations, but anyone can sign the declaration in support of us doctors and healthcare workers, teachers, parents, anyone can go on and sign. And so I think it really is, it is our issue to sort of clean up, having the support of everyone who's involved, because it does touch, teachers, community members' lives, that we encourage them to speak up also.
I'd like to add one more thing, and that's just the whole impact of media on children and social media in particular. And children are definitely being recruited. Abigail Schreier's book talks about it. Miriam Grossman's book, Lost in Transnation, talks about it. TikTok knows what they're doing, and these kids are being, if parents really need to know what's happening, and it really opens your eyes when you start reading and finding out what's happening on social media. A young teen can post something, just said, oh, something sad happened to me today, and immediately will be bombarded with messages that say, well, maybe you'd feel more comfortable if you were a boy or a girl. And children and adolescents are definitely being recruited through social media. And there is a definite, when you look at how the adolescent brain works, peer pressure, we've known it for a long time, but now they're showing it on, MRI scans and functional MRI scans and PET scans, and what areas of the brain light up when there's peer pressure. And so we know there are classrooms where, 50% of the girls have transitioned, and that there's something just inherently, we all say there's something wrong with that situation. 50% of girls in one classroom are not all going to have the same sense of feeling uncomfortable in their biological sex. What is the inner hurt or the trauma or the whatever they're looking for that they think this will relieve for them? So I just encourage parents and physicians who often just don't understand what's going on. We don't have time to sort of investigate the social media, find out what's going on, keep children off of it as long as possible, not just for that, but for lots of other, we know there are other harms to social media. So anyway, just be careful of what's happening there.
Yeah, those are such great points. And I think there is a lot more conversation happening about that. That has become, I think more of a, mainstream conversation. I think, Jonathan Haidt's new book as well. And I think he's, been involved or influential in advocating certain states have, I think, started to pass some policies about phone-free schools or just, age restrictions. Because like we grew up where it was like stranger danger was somewhere, outside in the neighborhood, and people have commented that it's actually, reverse now. It's like online, is that enormity is being more and more recognized, but just more people are talking about policies to change that, even, phone-free schools, or phone-free Fridays. I've seen a couple different things. So I do agree that social contagion component, clearly, the super highway can be, on social media. So I'm curious to ask, if would you guys, if someone came to you or your kid said, hey, I want to go to medical school, I want to be a pediatrician, what would you say to them, and how would you, I guess if you said in the affirmative, how would you help them navigate those waters?
Yeah, I still think it's, one of the greatest professions because it combines, that compassion, that serving others with the science, and with that leadership role. There's so many things as a physician that you're privileged to, and, there's much more than just, the biology that you learn. There's just so much more in it. And so, I would encourage my kids, to pursue medicine. I think there's more you can do with medicine now. I mean, look at us. We're examples of, how you can, be outside the clinic and make an impact, at a broader level, make a difference. So, but it's different. I mean, I'm sure every physician generation says this, but, medical students are navigating, so much more. And so we like to support medical students too, and making sure they're equipped with, asking the right questions and approaching this from, a science perspective and not a political or other agenda. So I think, we need good people in medicine, right? So we have to keep encouraging good, smart people, compassionate people to go into this career.
It allows, physicians have this incredible responsibility because we touch people's lives in a very different way when they're vulnerable. It's not like when you go visit or the plumber comes to your home or you go to the mechanic. It's a much more personal and intimate relationship. I count my blessings that I've had those kind of relationships with, hundreds, if not thousands of families, long term, seeing them through highs and lows, crying with families, I just got a graduation notice from one of my former patients, the fun part. And I agree with what Dr. Simon said. I would absolutely encourage people to go into medicine. It's a special kind of relationship with families and people, and interpersonal relationships. But I would say you better know your science and your facts, and have much more sort of, in a sense, ammunition. I don't mean it like that really, but you need an armamentarium of truth if you're going to go into this, because you are going to face different difficulties than we ever faced during our training.
Yeah, and that's why, again, I really appreciate what you're doing with your organization and with the coalition building and the collecting of the information, and also all, again, all the other advocates and researchers and folks out there trying to build new things that are places that the younger generation can join and be connected to have a community and get the information, so they don't feel alone, but they can properly document in the chart. They're properly armed, with the information in conversations. And as they go up in the ranks, they'll be called on to be teaching people below them. And as we know that with the digitization of healthcare and the decision support tools, as they're called, basically integrated into electronic health records, and a lot of that, I look at that more to see like what, how quote unquote up to date is it really? And on this topic, it really just lags behind with obviously just very old references. And even though they say they're looking at the, constantly updating, it's just really, I've been monitoring it for years, but ever since the CAS report, none of it's updated or even acknowledges it. And, we know that the younger generations are relying on those tools more so than, we did when we were going through, because they didn't exist. We can sleuth out quickly, like, yeah, that's not up to date. That's not actually accurate, or we know how to cull out the information properly. But, my concern is that obviously the digital natives, don't know that yet till they've seen maybe hundreds of patients. And so again, I think that it's so important for physicians and other people who are helping in the medical decision-making process, to be having this type of information, to access. So again, I think very practically, because I'm still practice, that it's like, well, I can go here and I can feel confident in documenting all of that. So, I mean, do you guys look at the decisions? Have you looked at the decision support tools related to this topic that are integrated into electronic health records? I know, Jane, you're retired, but for us, like Jill, have you seen that and looked at what's integrated, and maybe you can get stuff integrated into the hospital?
Right, right. No, I mean, it is true. You hit a good point there, that we have to partner with technology companies. It's not just the medical doctors. It's, working, even like social media to get the message out there, tools that we're not used to traditionally using in medicine. But yeah, I've found those to be lagging. I mean, I don't go to them, anymore. I know, but there's still, there's still good references, there's still good resources, but I think having a more critical eye, and teaching new up and coming medical students to have that critical eye is key when, we're leaning towards AI and, all this information, which is a little bit scary, to not quite know what's going on behind the curtain there. So I think, this back to the coalition building and talking to, physicians outside your specialty, outside your circle, getting that broader perspective is just so valuable. And I hope somehow that can be preserved. And I think there's a way to do it. I think we have to stay on top of this technology and use it to our advantage, and have a voice in it as it's being developed.
And remember that the technology and all what goes into the medical records as they, how to code it and everything, it's based on what some physician said was appropriate medical care. And so I think we're so old, I'm so old. In the 1960s, the mantra was question authority, question authority. And toward the end, when I was, still teaching, the residents were not questioning anything that was coming down. And when we talk about SIDS or any other topic, and I'd say, look, this consensus quote from the AAP was written by 4 people. 3 people got off the committee because they disagreed with what was being written. Question it. And there's this reluctance now to question authority. And I don't want to be a rebel, but I want to say to people, question authority. And Dr. Cass, she called out the AAP and she literally said, you are holding on to a position that is now demonstrated to be out of date by multiple systematic reviews. Question authority and dig deep and learn the truth.
That's such an important message. And as we're coming to the close in a few minutes here, I just wanted to remind folks that Genspect has tons of resources. We've got a new FAQ out that is updated and expanded, so you can look there. And again, we've got webinars planned. We've got an in-person conference coming up in Portugal in September, and some other things we're working on. And I wanted to give both of you an opportunity to say a few closing remarks and make sure to highlight, again, where people can go to read and sign the declaration and your other resources as well.
Sure. So the declaration is doctorsprotectingchildren.org. And like I said, anyone can go on there and sign in support. And there's a way to stay private. We understand the threats that physicians are under, but we encourage you, especially physicians and leaders of medical organizations, to sign on, be a leader. So doctorsprotectingchildren.org. And then the other site I mentioned is biologicalintegrity.org. And that is just a slew of resources for parents, physicians too, policymakers, teachers, on anything about, gender dysphoria, the frequent questions. It's just lots and lots of resources on there. So we encourage you to check it out.
And all the resources on both the ACPeds site, and I know Genspect too, and Biological Integrity, they're all scientifically referenced. And then we just want to say thank you to Genspect and to all the organizations that signed on to our and are part of our coalition, because without you, if this had just been ACPeds, it would have gone nowhere. And we really needed the support of all the other medical organizations and professionals who signed on. We're so grateful.
Yeah, absolutely. Thank you, Dr. Mendoza, for being one of the first to jump on this. Thank you.
Well, thank you guys again, really, for putting it together and having the moral courage, to be out there. We need, we need to really, make sure that we're doing more and more of this. And so, we'd love to have you back to discuss like the progress on this and, other initiatives that hopefully you'll be working on. And also to remind people that this is being recorded as well, and it'll be up on YouTube for those who, haven't had a chance to look at it. But again, I really appreciate your moral courage on this. So with that, we are going to sign off, and I appreciate everyone watching. I think we've got maybe 1,200 people on Twitter. I haven't looked, maybe you guys can, which is not the 53 million, but I'll take it. So, okay. Well, thank you.
Thank you.
Okay. Take care. Bye-bye.